After a 2-year hiatus, the Toronto Beach's Easter Parade is back.
I'd say we missed it quite a bit. The kids certainly missed it.
It's not as crowded as it usually is. A lot of people are being cautious, and that's okay too.
Cautious is the word of choice for this Montreal area rabbi. For the first time since the pandemic started, her synagogue organized a communal Passover Seder.
Whereas in the past we might have had 90 people, this year we had 30. We had everyone rapid test before. We kept people at small tables.
With Easter, Passover, and Ramadan, many Canadians are celebrating important holidays this weekend. And for the first time in 2 years, there aren't restrictions to factor in, so people are having to make their own decisions.
I personally had a lot of questions about, is it okay to? And that's really hard to answer because I think we cannot have a zero risk situation, but we can do reasonable things to reduce the risk.
Parishioners at St. Michael's Cathedral Basilica in downtown Toronto told us reducing risk was still top of mind this Easter weekend.
We just had a small gathering.
I don't care how much they lift it, I'm keeping the mask on.
While restrictions are mostly gone, experts emphasize vaccination, masking, and good ventilation. And some warned about relying too heavily on that rapid test, especially if you're experiencing symptoms.
A negative was never meant to tell you you're not infected. It was always meant to tell you that you are less infectious. And with Omicron, that can change quickly. So test right before, and then if you're worried about symptoms or the fact that you're feeling unwell, test again later.
Just another decision Canadians now have to make for themselves. Valeria, Cori-Manocchio, CBC News, Montreal.
Let's bring in Dr. Peter Uni, Scientific Director of Ontario's COVID-19 Science Advisory Table. And Dr. Uni, from your perspective, given where we are in this pandemic, how should people be conducting themselves?
I think it's important to realize that, for instance, here in Ontario right now, probably about 5% of the population are having an active infection, meaning they're infectious also for others. What this means is we just need to continue to be careful now, mask up, avoid crowded indoor spaces. If you haven't been fully vaccinated yet or need a third or fourth dose, get the dose as soon as possible. What is important here is, it looks as if things are subsiding slowly. We just need a little bit more time.
All right, let's talk about that a little bit. Cause for optimism.
Yeah, indeed. Again, here in Ontario, wastewater suggests that we have reached the peak. What this actually is all about is a combination of the good weather, people's behavior again, adapting to the situation, but also a lot of immunity. We have had roughly probably around 6.5 to 7 million infections since the beginning of December here in Ontario. All of that means is the immunity starts to drive the wave and starts to bring this down. And in a few weeks from now, things will look much better.
All right. And to an extent, what's happening in Ontario is happening across the country. Dr. Uni, thank you very much.
Thanks a lot.